Hi, Casey and Sarah.
Hello.
Hi.
It's so lovely having you. I'm really excited for this conversation. It's going to be a good one. And I also want to let you know that you two have the names of my favorite people in the world. My best friend is Casey, since we were in first grade.
Okay.
And my cousin, who is like my sister, is Sarah. So this is meant to be.
So you automatically
Fabulous.
like us, right?
Great.
I automatically love you. And my daughter was named after Sarah. Her name is Sarah Rose.
Aw.
So she was kind of named after her. I'm just a lot. Anyway, nobody cares.
We care. It feels good.
Thanks. But listen, let's get into who you are, Casey and Sarah, and why you're here talking to the Queer Fam Squad. Here we go. On your mark, get set, go.
I'm Casey, and this is Sarah. We met in 2015 and started dating in 2016. We consider ourselves Tinder adjacent because our best friends met on Tinder and we met through our best friends. We had 2 weddings, one during the pandemic and one also during the pandemic, but a little bit later. We have 2 kids that I carried, and we used Sarah's brother as our donor. The rest of our story is pretty much choose your own adventure. So we have inducing lactation, nursing after top surgery, informal milk sharing. Sarah has evangelical parents that are not involved.
Oh, whoa.
Trans pregnancy, known donor, and at-home insemination. And then also I'm a nurse practitioner that works in trans healthcare and teaches in midwifery school. And then Sarah was recently diagnosed with breast cancer. Yep. So we can talk about all of that.
And chemo right now. So
booyah shaka. Okay, so you went over. You did. And I don't fault you for it because that was a lot. That was a lot. This is a big story, and it encompasses so many aspects of the things we talk about on this show. And I'm so sorry about the cancer diagnosis. I said that earlier, and I want to say it on air so everybody knows I'm not being heartless here. I'm going through the same thing with my wife, so
I'm sorry.
We're gonna dig into that. Whew, we got a lot to dig into. So, Tinder adjacent. Before we get into your kind of meeting story, and we're gonna have to go over that part quick because there's so much else to cover. So much else. How do you each identify? I'd love to know.
I am trans, non-binary, just trans. Use they, them pronouns.
Yep.
Love it.
And I'm cis, and I use she, her pronouns.
Okay, I love it. Okay, thank you. And I'm she, her as well. But I think you know that because you listen.
Yes.
All right, let's get into how you met. So you met through a friend who met on Tinder, which is amazing.
Yeah.
Yep.
So my best friend, who I've been friends with since our freshman year of college, she met her now wife, and they have a baby together as well.
Aww.
They met on Tinder. The first match, they pretty much started living together after about, 1 month?
As we do.
Moved to DC together. So her now wife was best friends with Sarah.
We worked together right after college. And so I started hanging out with all of them. And the first time we met was at a Halloween party. And you were Ron Swanson, and you were sharing a mustache, your mustache collection for my costumes. But then, a year later, after hanging out a lot, we started dating, and we were kind of apprehensive because we were like, we don't want to ruin this friendship vibe. It's like felt high stakes, but everything's gone well. We're still just like together. A 4-pack with our other friends. So
I love that. Still going strong.
Yeah.
Still going strong.
Yeah.
I ask this question all the time. Were you both living that queer life before meeting?
I was. I had been out as like bi, gay, something since college, and out and dating women at that point. And then I was the first not cis man that Sarah ever dated.
So I was starting to think about it around the time if I was queer at all. And Casey's the best. So honestly, if you had been a cis man, I think we'd still be together.
Obviously.
Yeah.
Obviously. It's the person.
Yes.
It's the person.
Yeah.
Aw. And okay, so you did allude to your evangelical parents. Was that a thing? Was that tough or?
That's tough. I mean, it's still tough, but it's been a while now, and I have a great therapist. So, but they're not involved in our lives at all. And that's been a hard decision. And, but I mean, maybe it's not forever. Yeah, we'll just have to see how things go. It's hard setting boundaries, but
sure is.
Yeah.
Yeah, it sure is.
Yeah.
I'm so sorry for that.
Thanks.
This was your first queer relationship, Sarah?
Yes. And I kind of was like, I was like the favorite child, not the favorite, the unspoken favorite child. I was so close with my family. So I was like, okay, I'll ramp it up. I'll do it. Like, they love me so much. They will understand. And it's just really hard for them. They're really like ingrained in their evangelical circles. And they're just like, it's really hard to get through to them about, they didn't want to meet Casey. And then when we had kids, they've kind of alluded to maybe wanting to meet them, but I'm like, you have to meet Casey. Like, we're a whole family. So they really want me to have like a separate life with them. But I just like, I want them to know all of me if they're going to be involved in our lives. So yeah.
Wow. That's tough.
That's
I'm
tough.
sorry.
But Casey's family is like so wonderful. So, our kids they don't feel like they're lacking. They're very young, but
they have the village. They have the village.
Yes. Yeah. So
I hope they come around someday, but for the whole.
Yes,
Yeah.
the whole thing. Yeah.
You can't take one without the other. No way.
We're very lucky in that, like, where we live, there's a lot of like queer churches that we're like, spirituality is still important to me. Them rejecting us was really hard for me in that part of my life. But I've had a lot of like, queer churches that have like opened arms, accepted us, obviously. So it's been really good.
Well, that's good. And you have your people and you have your village. And that's really what we say all the time. Like, that's so important, especially for us queer folks who get cut off from families sometimes or have to cut our own families off. So, okay, let's get into this because like we have so much to cover here.
We don't have to cover it all, but if you feel like there's areas of it,
because you already said your brother was your donor and you come from an evangelical background. So I want to know what happened. I want to know everything. So let's get into it. Let's get into your family building journey.
My brother has always been, we've been really tight since growing up, and we go in the same circles. Like, he's really good. And he's always been really supportive of me with my parents and everything.
Because I was pregnant at our second wedding. Like,
okay, right.
It was 1 year apart because we had to cancel our first wedding because
That's so
of the
straight
pandemic.
of you.
I know.
Yeah, I know. It was like shotgun wedding. Yeah, it was an interesting experience. But it was great. We had a very gay second wedding.
As you do.
We went on this long walk. It was during the pandemic when we were like early on when you couldn't go around, you couldn't like be with anyone. So we were walking around the city and everyone would have like their lights on and we would kind of like be like looking in people's houses. And we were like, do we want to like try and buy a house? Do we want to get a dog? Do we want to have a kid?
Exactly.
And then we just decided to do all of those things
At once, yeah.
Which I wouldn't recommend. It was great. We love our like Sarah, but we just like really inundated ourselves with everything. So we got a puppy, and then we had talked about using your brother as a donor. We brought him into the backyard of the house that we were living at that time and had him over for like dinner and asked him, and he said, I've been thinking about this.
Like,
whoa.
Yeah. It turns out like years before, he is a mechanic, and he like had like a cool like mentor at one of the places he worked who like planted the seed. So my brother told the guy that we started dating, and he was like, they're probably going to ask you if you want to be a donor one day. And he's like, huh. And so he had been like thinking about it for years ahead, so that when we asked.
Sorry. You don't imagine this conversation happening between mechanics?
I know.
Like in the
Yeah. I'm not actually sure if my brother was like super open to it at first hearing it, but then the mechanic, I think, helped him like think about it in different ways. He got open to it. So by the time we asked, he was like, yeah, do you want me to
do you need it now?
Do you need it now? And we were like,
we're like, well, no, not really. Like, we were just going to ask.
Yeah. So ever since, it's been honestly like the best arrangement we could think of. He's not interested in having kids himself, but like has been like curious about the thought. So this is kind of a good arrangement. He always would have been like a special uncle or whatever. So
that's amazing and so beautiful.
Yeah.
And now I want to know about the conversation the two of you had about who's carrying, and how did you come to your conclusion that Casey, you would be the one to carry, and like
early on in our dating, it was probably our first date.
As you do.
We were walking around in an area that I should have known how to walk around in, but like I think we got a little bit lost. And I remember like pulling up Google Maps trying to find how to get to this restaurant. We were walking around the cemetery and we were talking about, I was like, do you want to have kids? But we were friends at the time. Right. We had just started dating. Sarah thought I was like this cool queer person who was like post-kid, post-marriage, like wanting to live like outside of that experience, which I think is very valid. But I have always wanted kids. I have lots of cousins. I'm the oldest of 3 kids, but I'm like the oldest of 12 cousins on each family side. And I worked postpartum. I'm like really nerdy about the like pregnancy and all of the like physiology of that. So I've always wanted kids. And so Sarah, you had said like, I mean, did you say like, I think I would be fine either way. Like, I'm not sure, I'd be fine if we didn't have kids. And I was like, oh no.
That's a deal breaker.
Yeah.
Red flag.
Yeah. But I think I was at a time too where like I just assumed growing up that I would have kids, I would get married to a man, like all these like predestined things. And then I was like, oh, I can like do whatever I want. And it was cool and liberating to be like, oh, like I would be also happy if I didn't have kids. So
yeah. So you were in a space where you were like enjoying your queer liberation moments and like really like questioning things and like, I think I'd be right. Yeah. Interesting. Interesting how queerness just really does make you challenge the norms.
Yeah, totally.
Yeah.
Which is so cool.
Yeah. But I was super open to having kids too. Like once, I don't know. And especially with you, I just like knew I'm like, oh, I would love raising kids with you. And a lot of the things I was worried about parenting wise, like I could just see that you would be an amazing partner in figuring all that out. So I know that Casey just has like a drive for wanting to carry. And I think I'd be interested in it, but it's not the same level of drive. And then once we had the arrangement with my brother, I just kind of like weighed everything around and I was like, this feels special. And even though I'll also miss not carrying, I think I like this more. And then we'll probably talk about it later, but with breast cancer, it's just been kind of like wonderful that I don't have to think about fertility and all of my treatments and stuff.
Oh, right.
So
yeah.
That's made a lot of that more simple. And I'm glad that I kind of got there before the cancer diagnosis. So I didn't have to like wrestle with that in the midst of all the diagnosis.
Oh, yeah, totally. Like for Anne, for us, Anne is just past that age. Like we're done. So we didn't have to think about that either.
Yeah.
Just like a whole nother layer of, and our kids look so much like her. It's so funny because I think so many straight people are like, this happens with queer couples, whether there's a genetic tie to both parents or not. But like, they're like, oh yeah, your kids look just like you, both of you. And you're like, I mean, yes, that's true, but you don't know that.
Genetically related to you have no idea. Yeah. And it does happen all the time. And then, me and my daughter like share a wink across a table because we're like, we're not genetically related,
Oh, it's cute.
It's so funny.
Yeah. It is so funny. But okay, so brother's on board and Casey, you're like, yes, I want to carry. I've always wanted to. And you come to an agreement. It seems relatively easy about how this is all going to go down. And thank God for brother.
Yeah. Yeah. We got so lucky. Plus, he moved to Philly right around then, too. So he was like, I mean, basically, I had been on testosterone at the time.
Oh, that complicates things a bit.
It does. And also, I'm someone who's like, I am not super dysphoric. I felt like coming off of testosterone for the purpose of getting pregnant was like not like being off of testosterone in general. Like it felt very like I am doing a hormone thing for a purpose of getting a baby. Like it didn't feel bad.
That's interesting because also this is something that you've always wanted. Correct me if I'm wrong, but it doesn't feel dysphoric to you to go on this pregnancy journey.
Right. I think it honestly, like in my experience with talking with other trans folks who've had kids, it's like very similar to what cis people go through. Like some cis women love being pregnant and find it very euphoric. And some cis women are like, wow, I hate body changes. This is horrible. Right. And I think that it's honestly like for me, it was I loved it. I would be pregnant all the time. I can't afford to have that many children. That seems like a lot.
Yeah.
But I think that it's just such like an individual experience. And for me, at least, I was lucky that it was, I had a really relatively easy time of it.
That's awesome. And it's funny. It is individual. And it's a really great point that you're making because I thought I was going to be, I'm sure you've heard me say this, like Mother Earth. I was excited to be pregnant. I had to do this. Yes. And then I hated every second of it. It was awful.
Yeah.
I did not enjoy it at all. So it's just so funny how, we put these expectations on these journeys, and it really is just an individual thing. And it sexuality, gender, none of this matters. It's individual. It's you and your body and your relationship to it. That's it.
It's such a transformation, and you just never know how it's gonna go for you.
Right.
I don't know. I think that I read this. There's this comic by A.K. Summers, which has some there's a little bit of old school transphobia in there, but I do really vibe with it. It's called Pregnant Butch. And
I know it.
It's she talks about just this idea that she was butch when she went through her pregnancy, and she just was like, I thought they were going to tell me I wasn't able to carry a pregnancy because there was something inherently wrong with my hips being too masculine, or
right.
Lipstick is needed in order to improve your fertility, or femininity in and of itself, or a feminine presentation is does not predict fertility. And there's so many ways in which your expression is not necessarily related to your ability to carry a pregnancy, or I don't know. I felt for me, one thing that was really important, at least to not have a dysphoric pregnancy, was that I had had top surgery beforehand. I think it would have been a lot harder if I had not. But the rest of it, the changes, the belly, all of that, I really I thought it was great.
That comic you're describing, it really does kind of illustrate this point really well, that it's so much more than the labels we put on things.
Yeah.
Queerness, best
amazing.
Thing in the world.
It's amazing.
Mm-hmm. Yeah.
But everyone thought Sarah carried the pregnancy.
Of course.
Yeah. Still do.
Course.
Yeah.
They do. Yeah. And my patients, I was seeing patients up until I was 37 weeks pregnant. And I left and came back, and they were like, how's your wife doing? Or I was like, I saw you. I had a giant belly. I mean, it wasn't that big. I carried kind of small, but
but still
in this physical space, and people just, they don't see what they don't
what they want to see.
Yeah. So it was pretty a cult, even though I wasn't trying to hide it.
It's so funny. It's really interesting because I think people assume that I carried both of our children too, and I didn't.
It's so interesting how that happens.
It is. People see what they want to see.
They really do.
And assumptions are made just regardless of how hard we try not to, or I don't know if everybody tries not to, but assumptions get made. You got pregnant.
Mm-hmm.
You did at home.
Yeah.
Mm-hmm.
How'd that go down?
I almost don't want to share because it's annoying.
Oh, God. You're one of the quick ones.
Yes, we both times. I will say I was very diligent at tracking, but a lot of people are very diligent at tracking. And I come from a family of a lot of unplanned pre-marriage straight people getting pregnant at young ages. So we were lucky in the fertility department with
That's great.
First try. Both times.
I don't hate you. I'm
sorry.
you. It's fine. No, I'm just kidding. It's great. It's amazing. But also, you had to stop taking your testosterone.
Yes.
How long did you stop before you started trying?
Both times, I think I gave myself about 4 months before then I was going to plan on starting to track. And then I think I tracked for a month or two before trying, maybe only 1 month of tracking, and then trying to coordinate.
Okay. That's good to hear.
Mm-hmm.
That's great. Because the truth is, and you can speak to this way better than I can, Casey, because you're actually a nurse practitioner and I don't know any science nor medical anything. But the truth is, testosterone doesn't necessarily affect your fertility, correct?
We don't have any reason to think that. It definitely impacts your fertility when you're taking it.
Well, because, it stops the main function of the period, right?
I think about it just any birth control. So it kind of shuts down. I mean, it hasn't been studied as birth control, so it shouldn't be used as birth control, but it probably works like that. It probably shuts down ovulation. It probably thins the endometrial lining and makes it so that you can't get pregnant. Mm-hmm. But once someone's not taking it, and once it's out of your system long enough to start menstruating, then ovulation starts back up. And it's really, the thought at this point, I think, is that it's more about how long you've been on testosterone in terms of the longer you've been on testosterone, the older you are. And it's age that is impacting fertility more so than the testosterone itself. So,
oh, that's interesting. That's interesting. I never thought of it that way.
Yeah.
And also, And also, why don't they study this shit? Like, it pisses me off. We need more studies. Like, what the hell?
No.
It's literally like a Facebook group with a bunch of research. research.
And this podcast.
And this podcast, 100%. Yeah.
And I make sure I let everybody know I am not the expert. I am not the expert.
But right now, the research, like the studies we have are like people's stories, and you have collected people's stories in a way that's so helpful. So it's great.
Right. Yeah. So I'm glad to get a little bit of insight from you who's gone through it. Everybody do your research. Everybody find that Facebook group and listen to these episodes and find it and share them amongst yourselves out there, because we're the only ones who are putting that knowledge out there somehow. So
I'm trying to teach nurse practitioners and midwives about this stuff. I do have integrated it into the education a little bit. So hopefully.
And you and others like you are really helping to change the world for the better, despite the asshole regime going on right now. The ass foolery, the ass hattery. I don't know.
I like ass hattery. That's great.
I didn't think ass hat could get better. But you just did it.
Look at that. We did that.
Level up.
Yeah, we did. Just leave it to the queers.
Yes.
Okay, so you get pregnant pretty quickly, pretty easily. And donor agreement, donor contract. How did y'all make that all happen, and what went into it?
So I made our own donor contract using a combination of something from Maya Midwifery that I found online and Rocket Lawyer, which you can get for $1 a month. And I just finally canceled that subscription by accident. It was going for a while. So that contract, which in our state, it may or may not hold up in court, but I wanted to have it in place before the insemination. So we had that in place. And then during pregnancy, we actually worked with literally like every queer in the known area works with the exact same law firm, who is they're wonderful. And they did our estate planning and second parent adoption. What did they call it? Confirmatory adoption was their language that makes it seem less like second, like it's confirming your parentage. I don't know.
More
I thought
inclusive.
That was nice.
Yeah, more inclusive. Do you want to share the name of it in case there's anybody in your area?
Journer Law.
Journer Law, y'all. Put it on the list.
Yeah.
Journer Law.
PA Philly area, they're wonderful. You might already know about them because that's anyone's recommendation. They're so great.
That's awesome. Okay, good to know. And was it easy coming up with your guidelines for how the relationship was going to be? Did you have a lot of conversations with bro? I'm going to call him bro from now on because that's fun to me.
Yeah. He's pretty much just like, whatever you guys want. And we're like, so we actually paid for him to go to therapy for a little bit before like it all went down. Because we were like, we want you to like think this through and be like on board. We wanted them to be in each other's lives like from the get-go. So what other things do you think we considered that?
He didn't have a primary care provider at the time. And I was like, you need to get tested. He was in a monogamous relationship for the first kid. For the second kid, he was not. So then I was like researching condoms. And I was like, use condoms. So I was like, what kind of condoms do you like? I was like, you have to use it for oral too, because you can get oral STIs. Yeah. And he was like, I was like, most people don't talk to their brother-in-law about this stuff. But
you got real close and real quick.
I talk to everyone about this. So he and I are very close now. He'll like ask me questions about stuff that I'm like,
that's amazing.
Yeah. So we had to talk about like, sexual health.
Yeah, like so that's the thing. Like if you're going into a known donor situation, regardless of if it's a brother or just a friend, right? Like you have to have a level of comfortability with each other to have difficult conversations because you got to go deep. You do.
Yeah.
You need to know about there is a level of risk that you don't have when you use a sperm bank, because there's the screening, there's the, luckily we know his medical history because we've known him Sarah's known him since his birth. And they have the same family history, but
he's a younger brother.
So I think that makes it a little easier. But yeah, you have to do the STI testing. There's all that stuff that the banks usually do for you. Or even if you use a known donor, but you're doing it through a fertility clinic, they will do all of that for you. And so if you're doing it at home like we did, you really should make sure you're getting like HIV tests, syphilis tests, gonorrhea, chlamydia, which can impact the person who's getting exposed to the sperm because they're not like washing it or anything, but also the pregnancy too. So
yeah, all these things. And it sucks because it sucks that we have to think of these stupid factors. You know, like if you're going the sperm bank route, it comes with its own set of fallbacks and scary things. And if you're going the known donor, same thing. There's so many things we have to think through, so many hoops to go through, and that's nature for you. But if only.
it would be nice if we didn't have to do that. But
so you figured it all out. You got everything buttoned up. You got all the paperwork done. Important.
we even did. There's what is it called? So you can't do the second parent adoption until after the baby is born. So we got something called
Like a parentage order?
Yes, to protect during the pregnancy, mostly because we were worried about if something happened to me. And because Sarah's parents are not super
right.
We were just worried, and we wanted to make sure that she would have legal rights to the kid if something happened before we had a chance to do that.
Which is smart.
Yeah. And that's why we did like our will and everything at that time too, to just make sure it was like very clear what my,
intentions. Nobody can swoop in and say, no, this child should be put with this
We joke if they're like, oh, should go back to my brother.
He would be like,
you can.
He's like, I'm really hungover. I just don't.
I was at a rave last night. I don't know that I'm up for
like
this.
every time he comes to visit the kids, he's so great. But he's just like lives a completely different life.
Yeah. He's living his best life.
Yeah,
good for him.
Yeah.
That's super awesome. And the fact that you got everything buttoned up, and because I think it is important to highlight that for all of our families, especially right now, get the paperwork done. As much of a pain in the ass as it is.
It was over $5,000 for all of it. I mean, not like, so just the second parent adoption is cheaper than that, but for all of the estate planning, very expensive.
There are more frugal ways to go about it. And it sounds like you tried to be frugal with it as best you could. But we're going to have to like save some money and shell out some money, or put some money on it. Put some debt on your credit card, or like me and my wife did, take a loan out against your pension, but like get it all figured out, because we just don't know. We never know. So, okay. So he had baby number 1, and it sounds like he was totally on board for baby number 2. There were no hiccups there.
No. Yeah.
Amazing. And now you have your 2 beautiful babies.
Yeah.
And you are in the thick of it, because they're how old? 3 and 11 months?
Yeah. Yeah. It was probably closer than we retrospectively might have done it. But our first seemed so young when the second was born, and we didn't expect that feeling.
Yeah.
And we were like, but oh my gosh, they love each other.
Yeah.
And they get along. Oh, wow. Lucky you.
They're obsessed with each other.
They are. I mean, they also he wants her to be right next to him, but not touching any of his things. So I can't pick her up, because then I get in trouble for her not being there. But if she's there, she can't get in touch of stuff either. It's impossible to ask.
Oh my God. It's amazing. That's good. My kids, I wouldn't say they get along. But they have their moments.
We're still early days, so who knows where this will take us. But
yeah, you're on the journey, and it's a beautiful one. And so let's talk about the next journey you just embarked on. Unless we missed anything with your family building.
Oh, I did induce lactation for the first kid.
Let's talk about this because Casey, you had top surgery.
Yes.
Let's go into this. I want to hear, because I don't know, can you chest feed if you've had top surgery?
So it really depends. I guess the big thing is you will not make a full supply. There will always be nutrition coming from somewhere else. Yeah. But I had a type of top surgery that is there's no nipple grafts. So it's similar to a breast reduction, but a complete reduction.
Uh-huh.
So they never removed and put my nipples back on. They always were in place.
Oh. They can do that?
They can. Yeah. It depends on the anatomy and the surgeon's skills and what they recommend. I was young. I was do whatever you think is going to look the best.
So do you have feeling?
I do. Yeah. I didn't.
Wow.
For years and years, I didn't have much sensation. And it's even comparing the first pregnancy and birth to this, to now, it's a completely different, I have so much more sensation now than I did.
I didn't even know they could do that.
Yeah.
This is new. This is new.
And it's definitely going to be different, like depending on the type of surgery, how long it's been since surgery to like the pregnancy. So like with Sonny, I tried, he latched a little bit, but like, I don't know, it was a first kid. He was small. I had high blood pressure. It was like a whole thing. But with Sasha, she still latches, and I did a bunch. I got probably about an ounce a day of milk. And now we just comfort nurse, like nurse to bed, nurse like when she's pissy, and then she gets formula. And like we also have done some milk sharing with folks.
That's another thing I want to talk about. But let's go into, Sarah, let's go into your induced lactation journey and what made you decide to do it and all the things.
Even retrospectively, it especially underlines that like inducing lactation for the second would have been so much harder. It was hard enough the first time, but with a like toddler running around, it just would have been wild.
Because it's a lot of work. I mean, it's commitment, right?
Luckily, with all of our planning and stuff, you have to start inducing lactation like so much ahead of time, like almost 9 months, 6 months ahead of time. So I started taking medicine, domperidone, that you can't get in the US. So we had to figure out all that. So I started taking that ahead of time. Then I was taking birth control pills and skipping the like placebo week to like trick my body into thinking I got pregnant. And then like maybe a month before the baby came, or maybe even longer, I had to start pumping.
I think it was like 6 weeks before.
6 weeks before. And it's just like incessant pumping. And it's not fun to pump when there's no cute baby there. You're just like, ugh.
No, it's not fun to pump no matter
what.
Yeah.
No.
It's the worst.
Yeah. So, but I mean, throughout all of this, it also was something that because Casey has so much knowledge and connections like in that world that made it like very possible for us. And Casey was like the best. When I would have to like pump at nighttime and I couldn't wake up, they'd be like, here, let me just put it on.
Like, that's queerness for you. Once again.
Yeah.
I would like take Sonny in to you in the morning, like in the like early mornings, because we would do like shifts when he was first born, and I would bring him in, and she'd be sleeping. I'd be like, stay sleeping, and I would just like quick like latch the I'd be like,
so
that's amazing.
I mean, I didn't do it for that long after he was born because he just like even comparing to our second, it just wasn't as easy for him to nurse, and that was hard. But it was still, like, I think back to the moment where he was in the NICU just for a night after he was born because his sugars were out of whack. So
scary.
Yeah. But, like, I had pumped milk that I could bring and, like, feed to him. And that felt really, like, cool. And I just remember, and I had the ability to, I mean, the first, like, 3 days he was born, he was great at nursing. So, like, I was in the NICU and just like having moments with him, like holding him and nursing him. And so I think back to that, and that was just like wonderful and
special.
Worth all of the really tough parts about inducing. Do you remember how much I was getting a day?
Yeah, you were making at least 8 ounces a day.
There you go. So
oh, wow.
It was something. I mean, and you were awesome at finding like donor milk. It was wonderful and also hard. So.
Right. I mean, both sides.
We focused on me for the first pregnancy. So I think that's probably why also you didn't really like latch with or do much nursing with Sonny, was that we were like focusing on me getting all of the...
You getting the milk, getting the nutrients. So you nursed for a while with your first.
2-3 months.
2-3 months.
You stopped by the time you went back from parental leave.
Yeah.
So.
And then for the second one, you didn't induce?
I didn't do, no.
Yeah, it's exhausting.
Sometimes I would try and latch to be like, well, maybe she'll like, this will comfort her. And it was like, nope. So.
Yeah. Amazing. And amazing that we can do this, and everybody needs to know this is possible. And also getting milk from others is also possible. That there's a whole like, I never did any of that. I don't know the world, but there's like a network you can like tap into, and there's milk shares.
There is. It's like, so I definitely, it is a risk benefit assessment, right? So like there's nothing wrong with formula. Formula is wonderful. It is 100% an appropriate food, and babies do great. And my kids both got a ton of formula from
I'm
like
so
the
glad
get-go.
you're saying this. Yes, thank you.
For me, I'm kind of like, there are some people who just like have a huge oversupply or just have a lot. And I'm like, seems like a waste if no one's drinking it. It was also like a pandemic with our first kid. There was a big formula shortage at the time.
Oh yeah.
So like it was really hard. Like we had to have like multiple different formulas, and kids don't really like going back and forth. And so I was like,
oh yeah. Once you get your formula, you got to You should. I remember being told you stick with what you use, right?
But that wasn't like possible because like you'd go to the store and it was literally like bare shelves. Even now, it's hard to get formula.
It's crazy.
And it's so expensive.
Yeah.
Literally buying a deep freezer was cheaper than to put all this donor milk that we had. Like just like using known donor sperm, like you want to make sure you're really like vetting where you're getting it from. Like a lot, like it started out for me, it was like getting it from friends that I knew, like other midwives who thought this was super cool. Like I had with Sash, our second baby, like a midwife that I work with who I've been friends with for a while. She just so happened to be the attending at the hospital when I gave birth. And
Aww.
she let Sarah catch Sash.
Yeah.
Aw.
That was really cool.
It was amazing and very painful.
For you. Yeah.
For me. But like our midwife friends brought their colostrum that they had collected that they had extra of. And
I just have to say it's so queer to be like, let's start a collective.
it's so it is such like the main people I see doing this like milk sharing are
So
like queer folks. Yeah, it really
so
is.
So queer. I love it.
There are safer ways of doing it, and I think it is a cool option to do.
I love that. And also, no shame in formula, and both my kids got formula, and breastfeeding did not work for me. It was a nightmare, and I was made to feel so guilty over it. And that's not cool either. So, whatever is best for you is the right thing to do. And also there are options, right? That's the beauty of it.
Yep.
And that's the queerness of it.
Mm-hmm.
Do you both go by mommy? Like, what do you call yourselves?
Sarah's mom or mommy or mama or whatever. And I am dad, but just because I didn't like any of the alternative names, mom didn't feel quite right. And so dad is like, fine.
Yeah, I realized as I was saying it, they're not even,
Yeah, dad is it for now, but I don't know. It's not perfect.
This doesn't have to be.
Yeah.
You'll figure it out, or your kids will figure it out for you.
That wasn't what I was hoping.
Yeah.
And so far, it just seems like dad is the easiest. It's what they say first, so that's kind of nice.
It's cute.
Yeah.
It's sweet. They know you both better than you want them to.
Yes.
Let's go into the recent diagnosis. And we're kind of like on parallel paths here because, Sarah, you said you found out was it October?
Yeah, October. How about for you?
We got the official diagnosis in December.
Okay.
The mammogram came back with problems in like November. So we're super close. Yeah. So let's talk. Let's talk about it. And I'll try not to cry.
Yeah. Oh, right. It's like, well, Casey noticed a lump in my breast in October. And I was just finishing up parental leave. Casey took theirs first and then I took mine. Like life was about the kids and Sasha being born. And I kind of was like, oh, weird. I mean, I'm 34. So it's kind of, I was just like, I don't have it in my family. I really was like, oh, I'll just check this once on, I don't know, like a checkbox to do before I go back to work, like go get a mammogram.
Right.
And really didn't think much about it. And then I went to the doctor's office. They said, yeah, we should get a mammogram and an ultrasound. And I went to the radiologist and they pretty much in there were like, oof, this looks like cancer. And I'm like, what? So, which I think is a good takeaway for anyone that ever has to go get scanned for a suspicious thing. It's like nice to have someone there because they really tell you a lot in the...
That was what I was shocked at too.
Yeah.
Because because I had just had a weird mammogram myself. So we had been joking about it. Ooh, we're like weird mammogram sisters, we were like joking. So I was like, oh, it's going to be fine. They're going to do the thing. They're going to put a staple in it so they can watch it,
Yeah.
When she was in there, she knew. She knew right away that, oh, this is more serious. They let you know.
Yeah.
Yeah. And then the doctor came in with a look on her face and she said to the doctor, that is not the look I want to see right now. She said, yeah, it's cancer. So they tell you right away.
Yeah. And they're like, there's no 100% certainty until you have the biopsy, but like they don't mince words. They're like, maybe that's to make you take it seriously. I don't know. But oof, that was wild. And so, and there's like the BI-RAD scale, which we know now of like after the scan, they'll give you like 1 to 5 of how likely they think it's cancer. And mine was like 5, which is the most. I'm like, oh my gosh. So, but I work for like a university / health system. So I was able to let, you feel guilty pulling strings when everyone can't pull strings, but at the same time, I'm like, I'm just going to use it. So it moved pretty quickly for me in getting a biopsy. And then
that's good.
That came back as cancer. I have lobular carcinoma and it's stage 2. So I had it wasn't a huge tumor. It was small enough that they suggested that I get a lumpectomy and then just like a reduction to match everything on the other side. Did that in the beginning of December.
Oh, so it moved
pretty quickly.
For us, it was like we found out in December and then we didn't know all of the info until like February.
Oh my gosh.
Or maybe it was end of January. And then it was like waiting for the first chemo. And like, I felt like it moved so slow.
Mm-hmm.
When you know you have cancer, when you know
you're just like, get it out, do
like,
the
let's
thing,
tell us what we're gonna do. Tell us what to do. Right.
Yeah.
So that's crazy. But it sounds like they pushed you into surgery first, and we're opposite.
And I think that depends on, were they trying to shrink your wife's tumor? Or
they're trying to shrink the tumor, and their reasoning is they want to see how the cancer acts before going in to operate. But she's definitely, I'm talking a lot on her behalf, so I hope she doesn't get mad at me. But she's definitely going to lose at least one whole breast for sure at the end of this.
It's just, it's hard. Well, they offered for me to choose if I wanted to do chemo first because there was a clinical trial I could enroll in for the type that I had. And I kind of was like, well, I'd have to get more biopsies. And that was the hardest part for me because I was like, if I have to get another biopsy, I want to be out cold. That was like terrible. But so I chose to do the surgery first. But I know that
we also didn't think so. Her breast surgeon, so we went and met with the breast surgeon first, and the breast surgeon she said that she would have a 70% chance of not needing chemo.
That's right. Yeah.
And then when we met with the oncologist was like, why would she tell you that?
Oh, wow.
So
because that was very unlikely, especially because she's premenopausal.
I think it's the age. It's like maybe it's 70% of people with this type, but based on my age, I wouldn't fall into the more likely to not get chemo group. So
because you're young and they want to blast it out of there.
Hopefully decades to not have this come back. But I'm also my tumor was hormone positive. So they have lots of ways to treat it with hormone therapy and stuff.
I think ours is hormone positive. It's HER2 negative.
Yeah, same here. Mm-hmm.
Right. So it's very treatable, and the prognosis, everybody we've talked to, we're going to get through this. Yeah. It doesn't seem like this is going to be a different conversation in the future. Like we just have to go through this mountain that we're on.
Mountain of treatment. Mm-hmm.
Yeah. The prognosis is good, which thank God. And if anybody's out there that it's not the same, that just knowing that there's a light at the end of the tunnel is keeping us going, which I can only imagine for you as well. So you had your surgery.
Had the surgery that went it went well, but they found more cancer in the margins of the tumor. That was stage 0. So it's less, which I think means that like there's not a metastases like concern at the moment. If it's stage 0, like they don't have to act as quickly about it. So now I'm doing chemo to kind of address like in case the tumor sent cells elsewhere in my body. So I'm like 2 months into chemo, and this is my fancy wig that I have because I lost my hair.
I didn't know it's a wig.
There's some really cool ones.
Yeah, did you get it through insurance? Because we have the prescription for the wig. I just
Cranial
don't think
prosthesis.
Yes, I don't think Anne is not. I don't think she's the type to rock a wig, or I don't know. I would be so supportive of it, but I don't know if she would do it. But I would never know that you're wearing a wig.
Yeah, this is Lena's wigs in Baltimore. They were like so wonderful. And I wasn't, everyone says like, don't spend a lot of money on a wig because you're not going to wear it and blah, blah, blah. But I was like, this is my comfort blanket that I want to have for when my hair falls out. So, and I've worn it a lot actually.
I have to say, it's been really interesting kind of like diving in with each other on the things that would matter to us, like the whole breast situation, like losing a breast.
Yeah.
And I talked about this on a previous episode with another couple who had to go through a mastectomy. You would learn so much from your friends having this conversation. Do you think you would be upset if you had to lose a breast, or would you want to be more aggressive and take them off? Yeah. And it's eye-opening because the people you would think don't necessarily respond the way you would think, right? Like, I'm not explaining that well, but like for me, take them off.
Yeah.
Take them off. I'm fine. No, like I have an attachment, but I really think I would be okay, although I'm not the one going through it. So there's that too. And my wife has pointed that out to me enough for me to realize that. But for her, she doesn't want to lose a breast. And I would have never even thought that would be a thing for her, which is funny. And then the hair thing as well.
Yeah.
I'm not going through it, but I feel like I would be okay. Like I'm rocking some scarves and, you know, and she didn't want to lose her hair. Like it was really emotional for her, you know? So it's just interesting. And we don't ever ask our friends or our spouses these questions. But you can learn a lot about each other, which I'm learning.
Totally. Yeah, I mean, I'm kind of maybe it sounds like the same spot as your wife about, so I've been like, the recommendation I've gotten now is after chemo is done to get a mastectomy, at least like on just the one side that I had the tumor, because it has that stage 0 cell spot in there too. A lot of people choose to get them both off because you just don't, I mean, I'm a little unclear about the risks for the second breast also getting breast cancer. It might be closer to what the general population's risk is. Like I've already gone through chemo and all of that. Like I don't want to do it again for the other one. So
I know.
Yeah. So that's still the thing I have to decide for when my mastectomy comes in the summertime. And then there's radiation. And then there's induced early menopause. It's just like, it's a lot.
I don't know. We haven't heard anything about radiation after.
That is like, we're not 100% sure.
It seems down the road, but.
But there's so much to this. It's just, it's like an awful, awful journey to go through. Awful. And you have kids. Yeah,
kids. And I'm more like your wife too, where like it's been really hard for me to like lose the breast that I knew and the sensation I used to have. And and then you decide what kind, like, do you want an implant? Do you not want to put anything in?
Right. That's a whole other conversation that is shocking. That people's answers are shocking to me.
And I'm like you. Well, I'm like, I had top surgery. So I'm like, I would just go flat.
And you're like, oh yeah.
I was like, I did go flat.
Yeah, I did that actually. Yeah.
So
it's
like
so personal.
And it's so different to go through, like when you want, like for me we literally had a very similar surgery
when I got my reduction
years apart, and we both like have supported each other through the same kind of surgery, but like the vibe is so different because for me it was like such a desired surgery, and it still sucks, like you still like have this whole recovery, but like
it's hard recovery.
It was for me gender affirming to have that, and for someone to go through like getting your breasts taken off when you wanted them and getting your hair like this, it's like a reverse transition. I think it's so dysphoric to lose these things that like give you your identity. It's been such an interesting experience to witness.
Yeah.
I also I don't know. I feel like I kind of like seeing your partner become a parent, like seeing Sarah go through this has been like her strength through all of this is just, I feel like I'm seeing her and getting to know her so much more like intimately and in so much. I would never want to go through this or choose to go through this, but I think it's made us, I get to know her in deeper ways, which is really beautiful. And I don't know.
Yeah.
First of all, that was beautiful. And I'm not sure I said something so nice to my wife yet. So I have a mental note.
Go ahead and take that.
And also, it's hard. And also, there's a parallel here between your pregnancy as well, that being a gender confirming thing for you.
Yeah.
Right? And the difference between the dysphoria. And dysphoria can be on any counts. It's not just a queer thing.
Yeah,
However, the way we're talking about breast cancer right now is so queer.
Yeah.
And there need to be more queer conversations surrounding this because it's an individual thing and there are so many facets to the things we go through when it comes to devastation like this and when it comes to family building and when it comes, and I think there needs to be more queer perspective on this stuff because I think we offer a lot of insight, insight. I never thought I'd be saying that my wife has breast cancer.
Yeah, it's wild.
Right? Like
I want to get a shirt that says cancer wife. I think I'm still going to get that.
She is like, my cancer wife.
Luckily, we can play around with it now. It's like, but it feels
that's
long.
How you get through.
Totally. How you get through it feels like a long journey. But I guess I look back to December and I'm like in such a different spot than I was then mentally. But there's something when you were saying the parallels Casey was pregnant. There was this book called Transformed by Birth do you remember who it's by?
Britta Bushnell.
And it's great. It's like not specifically for like queer experiences, but it is pretty gender neutral.
It's very it is entirely gender neutral.
Oh, okay.
And part of the book, I mean, it's like logistics about becoming pregnant, but then also there's a section about like where she goes into Greek mythology and talks about what's her name, Princess Inanna or someone, where it's like the journey to the underworld, and like she loses just like her clothes, her jewelry, her like weapons, I don't know, all these things she was relying on to get there, and then she's like transformed at the end because she has to go through all this hard stuff and these things that she thought she really needed. And you really connected with that during pregnancy because especially with your high blood pressure, and there were just things that you weren't going to have with your birth that like you wanted to have. And for me, that's been really helpful now with cancer, where I'm like, especially with the journey, there's like everything. I mean, I didn't think I was going to have to get a mastectomy after chemo. I was like, oh, great. So I had this plan and I'm like, okay, I'll lose this thing, but I can still like persist. And so it's been interesting to have the parallel experience where like I'm not pregnant, but this feels like, I mean, a lot of things are changing in my body kind of, and your body changes when you're pregnant. So
it is parallel. I love a good symbolic story.
Yeah.
I love some metaphors, and I love, art imitating life and all that shit. Spoken in such an eloquent way. There are so many parallels. We are putting a parallel between childbirth and breast cancer right here in this episode. I think that's bomb. That's fire. Like, yeah, they are related in some ways.
I thought I was going to get out of all the needles if I wasn't going to become pregnant. I was like, that was the thing that scared me the most, I think. And I'm like, ooh, the needles that I have experienced.
Do you have a portal? Or
I do have a port.
Oh, you did the portal. Yeah, Anna's doing we're hanging in with the veins.
Yes. Okay. Yeah.
She's got pretty strong, big veins. So she's lucky there. Yeah.
Is she doing AC or
like, what's her medicine for chemo?
She's on 4 different chemos.
Okay. Gotcha.
So it might be a different one than what you're doing.
I think so. Yeah.
The one is like doxy something.
Okay.
Co something. I don't know. They're long names. And then there's 2 HER2 ones that they combine. And then there's 2 separate. So it's a very long day on chemo day.
Yeah. Wow.
And how are you doing with the chemo? Like, how are your side effects?
I'm lucky. The first one I just finished was, they call like Red Devil, and but I call it Bridget's Fire. I saw someone do that in a support group. I think I had like pretty high expectations of how bad side effects would be, and it's been not that bad. So that's good. Yeah, very tired, and other things I could complain about, but nothing. My nausea hasn't been that bad. So that's good. Yeah, and my chemo days aren't that long, but I think that the regimen I'm on, they were like, you should probably get a port because the one medicine will like blow your veins. So
that's what they said. That's what they said to Anne. But so far, but she's
been good so far.
So far. Yeah. We've done 3 so far. So we got 3 to go.
If for some reason she has to get a port, I recommend the day that you get it, like keep medicine, like pain meds on board through the whole day, maybe like a nice like sleeping med at night, and then the next day feel better. But
she's having a rough time with the side effects, but I think she's on some really, really powerful chemo drugs.
Which it's terrible. When I do have side effects, I'm like, okay, I know it's doing something, and it's like fight. Like when my hair didn't fall out at first, I'm like, is anything is it treating my cancer? And then when it falls out, I'm like, okay, it's doing something.
The day we shaved her head was a very emotional day. Yeah, I'm sure you know.
Did you involve your kids at all in that, or?
No. Did you?
I thought about it, and then
they're young.
Yeah.
No, well, Sonny wanted to, or no, he was too scared of the buzzer.
Yeah, the buzzer sound. So yeah,
that makes sense. We went to my hair lady actually because we had this I had this really emotional day. So we found out that because she tried to do the cold capping where you try to preserve your hair, and then it wasn't working. Her hair was coming out. So she kind of made the decision the night before that she's going to stop. She's just going to shave her head. And so the next day I had a hair appointment, and my hairdresser, she knows me because I've been going, this takes a lot of work, this hair.
Yeah.
Mm-hmm.
And she was like, how are you? And that,
You're
lost.
like,
Ooh, the floodgates were opened. I cried, and I'm there for a long time because it takes the dye and then the pink, and then I cried the whole time I was there. Like, it was so embarrassing, and I just couldn't stop it. So these things take their toll, and it's not because I'm worried that she's going to lose. I don't care if she loses or if she has hair or not.
No,
it's just that it was so upsetting to her, and like having to watch her go through this is so hard.
Yeah.
You know, so
it felt like for me, like Sarah said before, you said you wanted it to be like lighthearted. What did you say? You wanted it to be jokey and lighthearted, your hair loss. Like you didn't want it to feel hard. And so I was maintaining that. But when you were shaving it, when it was coming out, I was tearing up, but I was also trying not to like show that because I was trying to be jokey and lighthearted. But I think my partner, like my love is, it is like the hair loss specifically is like, you know, that's what you associate with cancer. That's
right. Yeah.
It's like that physical manifestation of what's happening. And it was just really hard for me too.
It takes its toll. It takes its toll on both of you. It's hard. And I want to put a queer perspective on it, because I think as lesbians, and Anne and I identify as lesbians, I talk about this all the time on the show. We both are 50-50 with responsibilities. Like, I do the pickups and the drop-offs just because I have a much more flexible job. But she pitches in wherever she can. Like, she gets up early. She walks the dogs. She makes the lunches in the morning so that by the time she leaves, all I have to do is deal with the kid, you know? So we're very 50-50. We share things equally, and we each want to step up more. We each have this like mommy syndrome. Like, we want to be mommy. We want to be, you know, the caretaker. And what I'm finding with this journey is she pushes through, and she keeps trying to get up and do things. And I'm having to stop myself from saying, stop, lay down. Because if I do that too much, she gets mad at me. Right? So there's this like weird fine balance. And it's funny. I joke that having a wife with cancer, my wife still does more than a lot of my straight friends' husbands.
That is 100% true.
Right? And like, I'm having a hard time. Like, I can't tell her, take it easy.
Yeah.
Right? Because she gets mad at me.
Yeah.
Because we both want to, I don't know if you have similar experiences, but it's like the queer perspective in it is so interesting too.
I mean, I think it is probably so much better than if, no offense, I mean, I think probably we are doing a lot more than if they were married to men. Right. So they probably are actually they probably have it better than if they were trying to maintain a household while being married to men and having chemo. That seems hard. I
can't imagine. Like,
I know there's a lot of guilt anytime I can't do something. Yeah, even like when I was pregnant.
Yeah.
Right.
I feel guilty often, but I also, I've always been a sleepy person, and my like sleep fatigue is my biggest side effect. So, especially when your parents come down to help too, is like, I do lean in and I try and like step back. But yeah, the guilt is there where I'm like, oh gosh. Yeah. It's like, I haven't really heard that. I'm glad we're talking about this, like going through chemo, having kids. Like, you can't, the world still goes on. You don't get to rest. And you have that mom guilt, right? I want to be there. Like, I want to be doing things with them. So.
Totally. And as a lesbian mom, I don't feel like I'm doing that much more than I always have. Every once in a while, I'm making the kids lunches, that's extra. Every once in a while, I do the morning walk for the dog, but I don't feel like I'm having to step up too much more. And I think that that's a very lesbian thing that's my only perspective. And I don't know what it's like in straight families, but I think there might be or cisgendered straight families, I think there might be a much bigger difference when
totally.
A mother is going through breast cancer.
Yeah.
And all of a sudden somebody really needs to step up. But there's not.
Right.
Although my partner, my wife, has a lot of guilt, even over just the nights she's had to take off and she's gone to bed early,
Totally.
And so that's an interesting dynamic that we're encountering. And we had like a little tiff last night because of the food thing. She has no appetite. So I have to be careful how much I'm prodding her. Are you hungry? Are you hungry? So she got annoyed with me last night because I asked. So then I didn't ask when I was feeding the kids. And then she was like, I thought you were going to ask me if I wanted anything. And I was like, what? Wait.
You can't win.
You can't win, right? Because we're lesbians.
Yeah.
Another pregnancy parallel there.
Yeah.
It does feel kind of adjacent to when she was pregnant. I'm walking on eggshells here, trying to do right by her, but also be the caretaker and make sure that the needs are being met. But there's a fine line there, right? So
It's a lot.
It's a lot.
Yeah.
It's a lot.
I don't know if she's interested in like support groups and stuff, or if that's not really the time.
Tell us what they are, because
The one that I found the most helpful is called the Breasties app. And I don't know if you've heard of that, but that one's skews a bit like younger for diagnoses. And, but I mean, there's lots of ages on there and has been so much more helpful than some. I mean, there's good things about some Facebook groups too, but there's no spamming of like, oh, you put a post and then there's, what do they say where they're like, eat these 5 vegetables to cure your cancer. Like that's not on the Breasties app. It's very...
Right. It's also very LGBT. Like,
yeah, they have an LGBT section there. But you do, nice. I mean, when you were talking about some of the experiences that some marriages would have with chemo and kids, I read them and I'm like, oh my gosh, I feel so terrible. Like that's not something I'm particularly experiencing. So
of course, right. We need the queer version. We need the queer version of it because our experience is not. Yeah. Last night I was up a little bit later and went to bed early. And so I was looking for something to watch. There was some show about, I don't remember what it's called, about how house labor is divided amongst mom and dad and husband and wife. I said, okay, this could be interesting. I was so annoyed in the first 5 minutes. I turned it off. I couldn't take it because it's like, so like, oh my God, talk to some queer people, please. Because y'all are way behind.
Yeah. Like, it doesn't have to be like this. I feel bad for that. I feel bad, honestly.
I agree. The division of labor. That's the term I was looking for. Yeah. It's my heart goes out to you. I'm with you on this journey. And we can be community for each other too.
Yeah, for sure. Yeah. Oh, actually, so specifically about your wife's chemo, it sounds similar to what the 2 women on
the podcast. Yeah, breast cancer is boring. That's
you said that. About,
did I message it to you?
You mentioned it in your email, but maybe we should tune into that. Maybe
they're great.
It's because they had that similar with the HER medication as well, and it sounds like they had a similar kind of long day, lots of side effects. So that might be helpful. They're really funny and.
Oh, I love it. We joke about it, and that's what we do. We just joke. Our 11-year-old, we've had to have a conversation like, okay, wait. It's cool that we joke about it in the house. You got to be careful when we go outside.
Right.
People might receive that differently.
Yeah. You have to have the gallows humor. I mean, these days, it's just like piling up.
Yeah. Oh, my God. One thing after another.
I know. I'm like,
That's why I signed on for therapy. I'm starting next week. So
yay.
Yay therapy.
Very pro therapy in this house.
Yeah, I need it. We all need it. Everybody go get yourself a therapist and take care of your mental health. Yeah. This has been super awesome. And please keep in touch. And I'm wishing you all the good health vibes.
We're with you.
Yeah.
And we're going to get through this. We're going to get it through.